Last night's phone call between Ottawa and the premiers comes at a pivotal moment. Cases are surging, budgets are pinched, Canadians are understandably confused, scared, and maybe even a little fed up. The Prime Minister today said the federal government will continue to be there, but there's a limit to its support.
I think that our role was to make sure that provinces had extra resources to be able to get through the restart and this second wave. And we certainly did that with $19 billion. And we delivered these supports to the provinces, and we will continue to. The questions around exact expenditures in provinces, whether they were spent on the right things, those are questions that quite appropriately are to be asked by citizens in the provinces and organizations in the provinces of their provincial leaders.
Billions of dollars have already been put on the table in anticipation of exactly where we are today. Is the situation now the cause of a lack of federal funds or a lack of good regional leadership? Is it time to supports to the provinces come with accountability measures? We're joined now by Employment Minister Carla Qualtrough. Minister, welcome to Power Play. It's nice to see you. I hope you and your family are well. You've announced today an investment of $1.5 billion in the Workforce Development Agreement with provinces and territories to train workers whose jobs have been impacted by COVID. But I want to ask you what the Prime Minister said today about the money the federal government has already allocated to the provinces. That's $19 billion for the Safe Restart Agreement. Now, is this money being spent on healthcare, Minister? Do you know, does the Cabinet know where it's going?
Well, first of all, Joyce, nice to speak with you. Thanks for having me. Listen, we built in significant flexibility in terms of what the provinces could invest in with the $19 billion Safe Restart money, which doesn't mean there isn't accountability at all. It means that they could address the specific priorities they have and the specific realities in their own regions. But we are very we're monitoring, and I guess it would, for me, it would be bit by bit in terms of your own portfolio. But we know where the money is being spent, or we will know, depending on if it's been spent or not. It's a longer process to hold them to account, but it will happen for sure.
Now, we have, it's interesting because we have the Canadian Medical Association telling us hospitals are already reaching capacity. And as the number of cases grows, obviously people are getting a little bit anxious. The CMA tells us that doctors and hospitals are not seeing any of the federal money. So I have to ask you again, Minister, hospitals are the front line. That's where all healthcare in Canada is offered. So do you know where this money is going? And if hospitals aren't ready, shouldn't the provinces be putting money there? And shouldn't there be some accountability?
I'm nodding, Joyce, because I couldn't agree with you more. The reality is we invested significantly, even before the Safe Restart Agreement, in healthcare in this country in response to the first wave of COVID. And the Safe Restart money was absolutely meant, at least in part, to go to our frontline workers and the healthcare needs that each province identified. Listen, I know the Minister of Health is monitoring this closely. Public Health Agency, they're in contact regularly with the public health experts across the country, and there will be an accounting. I can't tell you today exactly how much per province is being spent, but I have every confidence that that money is being spent in the areas that the province is committed to do so.
But we're told that hospitals will not be able to handle this second wave, and the CMA is telling us, Minister, that doctors who are on the front line don't feel supported by governments. So I understand this is not your jurisdiction. I understand that perfectly well, but you are being blamed for it as well. So I'm wondering if there's any way that Canadians can find out if this money is being spent, for instance, in the ICU units. Is it to hire more nurses, more caregivers, more healthcare workers? It seems to me that there is a bit of confusion here as to where this money is going and why hospitals keep saying that they're not seeing it.
Well, it's very worrisome that the perspective out there is that hospitals aren't getting the the resources they need to deliver healthcare in this really incredibly difficult time for them. And so what I would say is I know provinces are investing in their healthcare systems, and the provinces are much better positioned, say, than I would be as employment minister to tell you how they're spending that money. But you're absolutely right that we need to know, and there needs to be an accounting of how every dollar has been spent, because we all need to work together to make sure that the hospitals and the doctors and nurses and other frontline care workers have the support they need to get us through this, because they're the ones getting us through this.
You know, today the Prime Minister said there are difficult choices that will have to be made. What are those choices, Minister? What are we talking about? Are we talking about a triage, choosing between a COVID patient and a cancer patient? Or is it about business and health? What are these difficult choices the Prime Minister brought up today?
Yeah, first of all, we don't see it as a choice ever between business and health. Making good public health decisions will be good for the economy. So we never frame it in our discussions as a choosing between in that particular situation. But what the Prime Minister was talking about very specifically today was not just financial resources, but human resources. There's only so much capacity within the Canadian Red Cross. As much as we can fund and support them, there's only so much capacity within the Canadian Forces. Like, there'll come a time, what he's saying, that we're going to have to make difficult choices. If one region needs something and we no longer have the resources to provide them, that will be a tough choice. Is how do we allocate our federal resources? That's at least how I understood what he was talking about. It wasn't at the kind of hospital level around triage. It was more at the how do we distribute federal resources level.
Well, we'll be following this, unfortunately, for many months to come. Carla Qualtrough, Minister of Employment, thanks so much. I wish you a wonderful weekend.
My pleasure. Thank you very much.